This is from the article Complementary and Alternative Medicine. This is in the St. Luke's Hospital Complementary and Alternative Medicine Journal. Frostbite. Frostbite occurs when skin and other tissues are exposed to very cold temperatures. It can happen within minutes following exposure to extreme temperatures and in above freezing temperatures if there is a strong wind chill, or if the person is wet or at a high altitude. Frostbite usually affects the hands, feet, and ears. Superficial frostbite injures the skin and tissues just beneath the skin, but usually does not permanently injure tissue. Deep frostbite also affects nerves and blood vessels, may result in tissue death, a condition known as gangrene. Signs and symptoms. The following are signs and symptoms of frostbite: pain and prickly progressing to numbness, pale, hard, and cold skin with waxy appearance, flushing from blood rushing to area after it's rewarmed, burning sensation and swelling from collected fluid that may last for weeks, blisters, black scab-like crust which may develop several weeks after exposure. What causes it? When exposed to cold, the body tries to preserve heat. Blood vessels near the skin surface narrow, forcing more blood to the core to keep the heart and internal organs warm, and this helps prevent hypothermia, which results when the body's temperature falls below 98 degrees. However, it also prevents the extremities, such as the feet, from receiving enough blood, which causes them to become cold. At first, the blood vessels alternate between narrowing and widening to keep them as warm as possible, but under extremely cold conditions, the vessels stop widening. When skin temperature drops low enough, ice crystals can form around the cells, freezing tissue and possibly rupturing cells. The lack of circulation that occurs when the body directs blood flow away from the extremities may cause damage. Who's most at risk? These factors increase the risk for frostbite: intoxication with alcohol or other substances, very young or very old age, cardiovascular disease, peripheral vascular disease, narrowing of blood vessels in the extremities, poor circulation, taking beta blockers, diabetes, hypothyroidism, exhaustion, hunger, malnutrition, or dehydration. Winter sports, especially at high altitudes, outdoor work, windy and wet weather, homelessness, severe injury, smoking, depression, previous frostbite, skin damage, constricting clothing and footwear. What to expect at your provider's office. Seek emergency medical care to treat frostbite as soon as possible. Your healthcare provider will ask you about your exposure to cold, including the time and the length of exposure. Your healthcare provider will also examine your skin, looking for signs of superficial and deep injury. You may not be able to see your injury until the area rewarms. Doctors may run blood tests and imaging studies such as magnetic resonance imaging, MRI, to determine the severity as well as any complications such as infection. Treatment options. Prevention. If you're going to be outside in cold temperatures, it's essential to prevent frostbite. Take these steps to keep warm. Wear several layers of warm clothing that allow you to move while providing protection from wind and water. Wear dry, warm gloves, socks, and insulated boots. Hands and feet account for 90% of injuries. Replace wet clothes immediately. Cover your head, preferably with ear flaps, in extreme conditions. About 30% of heat loss occurs through the head. Drink plenty of fluids and eat plenty of food during lengthy outings. Do not drink alcohol, smoke cigarettes, or drink caffeine. Watch for the development of white patches on the face and ears of your companions. These may signal frostbite. Treatment plan. Frostbite is a medical emergency. It's important to get conventional medical care as soon as possible. Remove constricting or wet clothing and immobilize the affected areas. Your healthcare provider will treat mild frostbite by rewarming the affected area, washing it with an antiseptic, and applying a sterile covering. Medical care is not available immediately. You seek shelter and rewarm a mildly frostbitten area by immersing it in warm water, 100 to 104 degrees. Repeatedly applying warm cloths to the area for 30 minutes. Never use hot water, fire, a heating pad, or any other dry heat, because these methods may burn when the feeling returns. Remove any jewelry from the affected area before rewarming, because the area may swell. Never rub or massage frozen body parts. Walking on a frostbitten foot if possible. However, if you are far from help, it's better to walk on a frozen foot than to thaw them out. Wrap the area in dry dressings between fingers and toes to keep them separated. And if there's any danger of refreezing, it's better not to thaw the area until you reach help. Thawing and refreezing can seriously damage tissue. If there is no danger of refreezing, treat deep frostbite by rapid thawing in warm water bath. The patient should be hospitalized and have a health care team look at the frostbitten area. Medication can help control pain. Healthcare providers will take steps to prevent and treat any infection. Deep frostbite is often accompanied by hypothermia, a medical emergency that also requires hospital care. Drug therapies. Your healthcare provider may prescribe drugs such as narcotic analgesic to treat pain, non-steroidal anti-inflammatory drugs to treat pain, and antibiotics to prevent or treat infection, or a tetanus shot to prevent tetanus. Aspirin and ibuprofen may be helpful, but evidence is limited. Surgical procedures. If frostbite has caused tissue death to any area, such as a hand or foot, amputation may be necessary. Usually this decision is not made for several until the extent of the damage is more evident. At first, frostbite may look worse than it is because the skin may be more seriously affected than the underlying tissues. However, if the person has serious infection, wet gangrene, or pain that won't respond to treatment, surgery may be required sooner. Studies show that regeneration of tissue using new techniques improves the result of surgical treatment, reducing blood loss and enhancing the healing process. Complementary and alternative therapies. It's important to seek conventional care for frostbite as soon as possible to prevent tissue damage. While nutritional supplements may enhance conventional treatment, maintaining the body's core temperature by dressing warmly, drinking fluids, and eating plenty of food before and during exposure to cold are critical to preventing frostbite. Nutrition and supplements. Vitamin C. One well-designed animal study suggested that vitamin C may have some beneficial effect on frostbite when paired with standard treatment. Antioxidants. When taken prior to cold exposure, individuals may help protect against development of frostbite or other cold-related injuries. Herbs. You may use herbs along with conventional medical treatment for frostbite under the supervision of a qualified practitioner. But you should never use herbs just alone. Speak to your physician before using any herbal therapies to make sure that they're right for you, and then they do not interfere with any conventional treatment. Cayenne pepper in topical form has been used traditionally in China and Japan to treat frostbite. Poplar buds are also known as balm of Gilead and balm of Mecca. May be used as for frostbite as an ointment or other topical formula containing 20 to 30% bud exudate to alleviate the pain and reduce the risk of infection associated with frostbite. Also used topically are calendula, chamomile, and horsetail. Aloe vera in topical form every 6 hours may help prevent further tissue damage. Homeopathy. Used studies have examined the effectiveness of specific homeopathic remedies. A professional homeopath, however, may recommend one or more for the treatment of frostbite based on his or her knowledge and clinical experience. Before prescribing a remedy, homeopaths take into account your physical, emotional, and intellectual makeup. An experienced homeopath assesses all of these factors when determining the most appropriate for the particular individual. Agaricus, primary remedy for the burning, itching, redness, and swelling associated with frostbite. Apis mellifica, for the burning and stinging sensation and redness associated with frostbite, particularly if there is excessive swelling. People who begin this remedy may also have a dull pain in the back of the head. Carbo vegetabilis, for people who feel faint or who have difficulty breathing. Lachesis, for frostbite with the blue or purple discoloration. The skin may bleed easily and irreversible tissue damage may result if it is not treated. Most appropriate for people who are restless and unsettled. Silicea, for frostbite in thin, frail people who typically feel cold and tired. The remedy is most appropriate for those who have pus-filled wounds. Massage. Frostbitten areas should never be massaged or vigorously rubbed. Prognosis, possible complications. The outlook for frostbite depends on the depth of tissue injury and can range from complete recovery to amputation. Possible complications of frostbite include the following: increased sensitivity to cold, changed skin color, faulty nail growth in the affected hand and foot, profuse sweating, pain with use of affected area, altered sensation in the affected area, arthritis, and skin cancer. A majority of patients have long-term residual symptoms, including pain, loss of sensation, swelling, hair and nail deformities, and rarely arthritis. Follow-up. Damage caused by frostbite is not always immediately evident. Healthcare providers will monitor your condition over weeks or months to determine the injury. Many patients have long-term symptoms, including pain, numbness, swelling, and hair or nail deformities.